Blood pressure is one of the most common conditions that we work with where we have to apply all of our principles. High blood pressure in our clinic is the #1 diagnosis that we see patients for. It's the thing that most physicians are getting evaluated on. How well do we do getting blood pressure controlled? Blood pressure means that the pressure of the fluid within your blood vessels, high blood pressure means that's too high. So I'm going to talk about the opposite real quick. If your blood pressure is too low, you're going to get dizzy. You're going to be lightheaded. When you stand up, you're going to wobble. You could black out, but high blood pressure, you can't feel. Just having a higher pressure is not the problem. The problem is having it too high for too long at the wrong times. So when you exercise, your blood pressure goes up some. It should, it's supposed to. When you get stressed, your blood pressure goes up some. It's supposed to. But when you're at rest, your blood pressure should come down. So we're going to talk about what the average run-of-the-mill normal blood pressure should be. It should be below 120 on the top and below 80 on the bottom. Parentheses, over 65, we can tolerate a little bit higher pressures, but that's another whole conversation. So we're just going to talk about run-of-the-mill blood pressures. Most people think of blood pressure as being a heart problem, but that's not true. The things that cause high blood pressure can be your heart, but it can also be your lungs, it can be your brain, it can be your kidneys, it could be hormones. There can be a lot of reasons that raise blood pressure. So high blood pressure makes something like a stroke even more likely. We're all familiar with the stroke that causes paralysis, but there's also micro strokes that you probably don't perceive or don't know you had. And when enough of these build up, we can start having memory loss and other things that can mimic other problems or just create some anxiety and confusion. Heart failure is another huge problem associated with high blood pressure. If the pressure's too high in the system, the pump's going to fail. And when your pump starts failing, we cannot back that up. We can't get it back. We can medicate it, we can help you be healthier, but we can't fix all of the damage. High blood pressure is a vascular problem, and I want you to understand that so you start thinking about it differently. Here's the real problem, beginner problem of high blood pressure in America, and the answer is sugar. The process of maintaining too high of a blood sugar tells your kidneys to hold on to extra fluid and electrolytes. That raises your blood pressure. We clearly have a problem with over-consuming sugar. We clearly have a problem with over-consuming carbohydrates. We have a problem with high blood pressure. We can notice that as you improve your nutrition, your blood pressure improves. We see all that. What role does exercise play? This is a great question. Exercise plays a critical role in controlling high blood pressure because when you exercise, you are putting your vascular and heart through ranges of pressure which work out the muscles of your blood vessels. Did you know your blood vessels have muscles? You didn't. Exercise is not just working these muscles and this muscle. Exercise is also working the muscles in your blood vessels. The more flexible and toned, both, that your blood vessels are, the better your pressure. The narrower and harder and stiffer they get, the higher pressure. Also, when you get past a certain age, you're gonna have some high blood pressure because everything is stiff and weaker and worn out at that point. So some of that we have to accept with age, and that's okay. What we want to do is keep things as healthy as possible for as long as possible prior to getting old. This is one of the core principles of preventive medicine is let's prevent it before it starts, which means we got to start younger. Hey, thanks for watching. And if you want to know some more really cool life hacks to get some balance in your health, then watch one of the next videos on our page.